trending medical crisis that is killing hundreds of men in their prime in Nigeria. Prostate cancer. If you ask 1 in every 10 Nigerian men, I bet they don't know have enough information about their prostate health, or even know what the prostate gland is in their body. This video is all about educating you and giving you insights into your prostate health and how to prevent certain diseases that would cause needless death in the lives of men. Come close. Let me tell you something about your prostate that you may not already know. The prostate is a walnut-sized, small accessory reproductive organ present in men. It lies just below the bladder and in front of the rectum. Then it surrounds the urethra, which brings urine from your bladder and passes it through the urethral opening during urination. The major function of your prostate is to supply fluid to the supply fluid to the sperm coming from your testes, which comes out as semen during ejaculation. At age 40, the prostate is usually the size of a walnut, but as men age, it begins to increase in size. By age 50, it's already the size of an apricot, and at 60, it might as well be as big as a lemon in men. And this is of importance in your prostate health, so much so that it helps you to understand the reason why you have some signs and symptoms as you age in life. As the prostate becomes bigger, it tends to compress the urethra, and then there is difficulty during urination in men. And that's why by the time you compare a young boy, maybe a baby, to a young child, to someone in middle age, and then an elderly man, you begin to see the stream of their urination varies. In a child, it's easy for them to urinate, and you see the projectile during the urination. As they age, when you start getting to the age 40, age 50, the projection of the urine begins to slow down. So much so that for some people at age 60 and above, it turns into a dribble. Now, this is not to say that that is the norm in all men. There are so many men, even 70 and above, that are still maintaining good stream of urine. But for us to understand that with age comes enlargement of the prostate, which also affects urination and some signs and symptoms. When the prostate begins to enlarge as regards age, we call it benign prostate hyperplasia. It is a natural thing. Like I have explained earlier, it comes with age, so you may not need to panic. Whether or not there will be treatment for it depends on the symptoms or signs that the person experiences. For example, I mentioned earlier, there are some people that may not even experience decline in their urination with age. But for people that start having discomfort as a result of the enlargement, then you may need to consider treatment options that are available for benign prostate hyperplasia. FYI, as we progress, there are 3 significant changes that may affect the prostate health, which we are going to be discussing. First is what I have mentioned, the benign prostate hyperplasia. Second, prostatitis. And thirdly, the prostate cancer, which is dreaded by every man. For benign prostate hyperplasia, I explained earlier that it occurs as a result of age. Basically, the causes are that 1, it happens with age. 8 in every 10 men would develop benign prostate hyperplasia. And of course, family history. It means if your father or your uncle ever had a benign prostate hyperplasia, then you are likely to have benign prostate hyperplasia. What are the symptoms of benign prostate hyperplasia? First, the bladder doesn't empty properly. You go to the restroom, you try to urinate. After you think you are done, you still sense that there's still something retaining in your bladder. So you don't end up expressing all the urine in the bladder. Another sign is that you feel the urge to urinate out of the blues. For some people, at least, you've been having the urge building up of the urine in your bladder. But in this case, without even notice or any build up, you just sense that you must urinate, the urge to go. You have to go and urinate. And then another sign is that during the course of urination, you start and then you stop several times. You are urinating of its own accord, the urine stops, then it starts all over again when you think you are done, and then stops again and starts all over again, and then you feel discomfort with that. Then for some people, before you even get the urine to flow, there is strain. You try to push and push before the urine starts flowing, and after a while you start straining again before you get more urine out. And lastly, the most embarrassing symptom is the leaking or the dribbling. For most men, after you're done urinating, you still have some of the urine retained in your urethral opening, and then you have to shake off in order to get all the urine out. And then even after doing all the shake up and everything, some people still discover that there is some urine leakage that has dropped in their underwear, and it's a very embarrassing trend. Okay, what are the treatment options? I mentioned earlier that not everybody needs to treat benign prostrate hyperplasia. It depends on the level of discomfort that the men experience. So the first line of treatment is what we call the watchful waiting. You begin to watch, okay? The enlargement of the prostrate, is it disturbing you from urinating? Is it causing any major discomfort? Are you voiding at all, or there's no more urine coming out and all that? For some people who are still struggling to get their urine going, flowing, you may not need to do anything about it. What I would just advise you to do is your constant once a year health checkup on your prostrate health. But for people who are beginning to have discomfort, then of course there are treatment options for them. Another thing or treatment that we always counsel is lifestyle modification, which means that you watch what you eat. Try and take adequate diet, rich in fiber, rich in phosphate. Eat lots of fruits and vegetables. Eat food rich in fiber. Take less of sugar. Then what are the times that you eat? Remember, with age, you tend to urinate more often as a result of the enlarged prostrate. So we'll advise, do not take meals late in the night. Then don't take too much water close to bedtime before you go to bed. Make sure that you give enough time so that at least you would have had enough time to go to urinate before going to sleep. Then you don't have to start waking up over and over again to go to the toilet in order to urinate. Then, of course, you try and do exercise. Try and avoid being overweight. Doing exercise makes you active, makes your muscles tone increase, so much so that you still have control over your muscles, and you can control your urination and control your bladder. Then the kind of food you eat to prevent obesity would help reduce the amount of fat that is compressing on your prostrate and inevitably compressing on your urethra. Avoid taking medications that are not prescribed. Avoid taking caffeines. Avoid taking alcohol. Why? Because caffeines and alcohol irritate the bladder and cause you to want to urinate more often. Avoid taking antihistamines or decongestants. All these would constrict your muscles and make it more difficult for you to urinate. So watch your lifestyles. Have proper sleep at least 8 hours a day, and of course meditation improves your mental health, gives you a better outlook to life, and then it just so much so helps you to maintain very good prostate health. For those who have tried these lifestyle modifications and watchful waiting, and then they are still having so much discomfort due to the enlarged prostate, then there are treatment options like alpha blockers reductase inhibitors that help to shrink the size of the prostate. There are also schools of thought or researches that show that excessive use of these drugs leads to prostate cancer. So you may need to weigh your options before you are commenced on these medications. There is surgical option, which is TURP, transurethral resection of the prostate, in which they would surgically remove a part of the prostate in order to create enough space for the urethra to breathe and be able to flow properly. We move on to prostatitis. Prostatitis is the enlargement of the prostate caused by infection. So basically, this is an inflammatory process caused by infection. As much as we say that benign prostate hyperplasia affects people from 40 years and above, prostatitis can affect anybody. It can affect a young boy of 14 years, it can affect a middle-aged man and also an elderly man, because there is an infection that is causing the enlargement of the prostate. Now, basically, the signs and symptoms of all prostate enlargement are the same. The only difference with prostatitis now is that there is associating chills and fever with the other symptoms, the dribbling and inability to empty, feeling of urinating out of the blues. And of course, the sexual performance is affected with prostatitis. What are the causes of prostatitis? Most times it happens to people who have had recent catheterization. So if there has been an unhygienic handling of their catheter during the time that they had the catheter in place, it may lead to infection. And then prolonged catheterization also leads to infection. It might be chlamydia infection, it might be bacterial infection, but once this infection is in place, it causes enlargement of the prostate while the inflammatory process is ongoing. Treatment is basically with the use of prescribed antibiotics, and then of course after a while the prostate returns to the normal size according to the age of the person. Finally, we'll talk about prostate cancer. Prostate cancer can be caused as a result of poorly treated or long-standing sexually transmitted diseases like human papillomavirus, which is notorious for causing so many reproductive organ cancer in men. Also, it can be as a result of family history. If you've had a father or a grandfather who has had prostate cancer, you may be at risk of developing prostate cancer. And for some men, it's as a result of poor sexual health, which also leads to sexually transmitted infections, and then is fingered for causing prostate cancer in men. What are the tests that we can do on our prostate? First, you can do a digital rectal examination. Remember, I mentioned that the prostate is located just in front of the rectum. So the doctor might decide to glove his finger and then insert in through the rectum to feel for the prostate, the size, the shape, the consistency of the prostate. Then of course we have PSA tests, which is usually done to find out if there is the presence of prostate cancer, and then they can proceed to doing prostate biopsy. There are so many tests that can be done, even MRI of the prostate can be done. So what do we do? As a man, your to-do list are: number one, constantly being active. Keep yourself active. Do lots of exercise. Jogging, swimming, running, even walking for those who are advanced in age. You may not need to exert so much energy. You have to constantly keep moving in order to be active and maintain good muscle tone and promote your overall health. Secondly, do Kegel exercises. Kegel exercises are exercises you do to strengthen the muscles of your pelvic floor, and then you can do that by constantly controlling how many times you stop and continue your urine while you are having your urination. Instead of releasing all your urine at once, you may decide that you are breaking it into 10 parts. You urinate, you pause, you urinate, you pause, you urinate, you pause, until you have totally emptied all your urine. Then you can also practice double voiding during the course of urination. Okay, you want to urinate, but you are breaking it into 2 parts. But remember, this is a conscious effort, not that it is caused as a result of your inability to void due to the enlarged prostate and all that. Then avoid antihistamines and decongestants. I don't want to start mentioning any brand name so that people will not hold me responsible. Yes, it's good to use medications when they are prescribed, but many people are addicted to medications. Before you know it, they are taking Piriton. Before you know it, they are taking medications that they do not need to take. So please avoid taking them, because what happens is that they cause the smoke muscles to constrict, and this makes it very difficult for you to void. Then don't delay. When you feel the urge to go and urinate, don't say because you are a man, your bladder has a larger capacity than that of a woman, and so you can hold it for longer. If you feel the urge to urinate, please by all means go and urinate. Then avoid caffeine and alcohol. I know a lot of people like taking coffee. It's like your daily dose, but the implication is that caffeine and alcohol irritates the bladder and cause you to want to go to urinate more often than you normally would do if you are not taking them. Then you try and drop weight even as you age. This cannot be, the importance of weight loss cannot be overemphasized. Most women are the ones who really carry this on their heads, because as they age, the hormones begin to withdraw and the tendency for obesity is more. But in men also, for the sake of your prostate health, try as much as possible to lose some kgs. Be intentional about your weight loss, because the more you increase in size, the more the fat compresses on your prostate, and the more your prostate compresses on your urethra. Then, if you are not giving me, see, so many people are of the habit of, oh, when I was sick, I had similar symptoms. The doctor prescribed this for me, so you too, you need that. They have become doctors of their own. Please, try and adhere strictly to medications prescribed by your doctor. Do not receive prescription from friends, because as much as we may have similar symptoms, our disease conditions might be different. So try as much as possible to only take medications that are prescribed by doctors and not that are given to you by friends or people who feel that they know what is wrong with you. And lastly and finally, try and have constant sexual intercourse, at least 21 times a month. This is a very controversial issue. I saw an article recently when some medical experts debunked the relationship between constant sexual intercourse and prostate health in men. But I'd like to tell you this. I've gone through so many journals, I've seen a lot of researches, I've seen different schools of thought, and majority of them maintain that constant sexual intercourse improves the prostate health. Why? We have mentioned earlier that the Prostrate is responsible for supplying semen, supplying the liquid needed for sperm during ejaculation. So by having constant intercourse, you are constantly moving the fluid in the prostrate, which means that there is no opportunity for too much infection to be static in the prostrate. That is the school of thought. No be me right hand. The information is available online. So it's important for men to explore their sexual health so that at least it can reduce the risk by at least 20%. That is what those journals say. Some even go as much as saying that it reduces the risk of prostate cancer by as much as 30 to 35%. But let's even take the lower range, which is the 20%. If there is a 20% chance that sexual intercourse would reduce your risk of having prostate cancer, I think it's better than no, better than 0% chance. And of course, I know what some people will be thinking. This woman must really like knacking for her to be emphasizing on this. Well, yes, so I do. At least I am very interested in maintaining the prostate health of my man. And as a woman, so should you. Encourage the men. So please, relax and give them enough chance to do the knacking. That is what they have been hired to do when you said I do to them on the altar. And believe me, you'd rather be more submissive to your man than stay by his bedside, praying, watching, hoping that he gets better in the hospital when he's down with prostate cancer. And for the men who believe that I'm a champion now, I've been doing this, and yet I was diagnosed of having prostate cancer, remember that some men still expose themselves to multiple sexual partners. Some men still expose themselves to the risk of developing sexually transmitted diseases, which might also lead to the prostate cancer. And of course, before you go for my jugular, remember that I mentioned so many things for men to do. One of it is healthy lifestyle. Avoid taking this medication, avoid taking unprescribed medication, do constant health checkup. So sexual intercourse is just one of the several lifestyle changes that you need to adopt in order to prevent prostate cancer. And I'm emphasizing on this, especially for men who are celibate, like Reverend Fathers, for widowers who have said, okay, I'm done with having sex in life and all that. You need to maintain healthy lifestyle choices. Eat proper diet, and also go back to everything I have said earlier on the things to do so that you will not develop prostate cancer. I hope you find this video very educative and informative. But just in case you have questions, you need further clarifications, you have things about your prostate health you would like to discuss with me, please feel free to reach out to me on my social media handles, or you can as well chat me up directly on my WhatsApp number, which is 08028600761. I am waiting to hear from you very soon. Till we see you again. Bye. Ciao. Love you.